Psychosis may have positive, negative, and cognitive symptoms. Positive symptoms are delusions, which are fixed false beliefs, hallucinations, which are perceptual experiences without an external stimulus, disorganized speech, disorganized behavior. Negative symptoms are diminished emotional expressions, lack of interest, poverty of speech, lack of motivation to complete goals, little or no desire to socialize. Cognitive symptoms are difficulty to remember things, difficulty to learn new things, and to understand things easily. The difference between psychotic disorders is the duration of illness and their diagnostic criteria. The duration of illness for schizophrenia is more than 6 months. If it is less than 6 months and more than 1 month, along with the diagnostic criteria A, D, and E of schizophrenia, then it is a schizophreniform disorder. If the duration of illness is less than 1 month, along with the diagnostic criteria A1 to A4, D and E of schizophrenia, then it is brief psychotic disorder. Schizoaffective disorder is a combination of criteria A of schizophrenia and major mood episode, and the duration of psychosis should be at least more than 2 weeks. Delusional disorder is non-bizarre delusions, and it should be at least more than 1 month of period. In schizophrenia, there is dysregulation of dopamine. Excessive level of dopamine in mesolimbic pathway may cause positive symptoms, whereas decreased level of dopamine in prefrontal cortex may cause negative symptoms. According to DSM-5, there is a diagnostic criteria for schizophrenia, and it should be at least 2 or more of the following symptoms, and these symptoms should be present for at least 1 month period, and these symptoms are delusion, hallucination, disorganized speech, and disorganized behavior. These are positive symptoms. They are added into the personality, whereas negative symptoms such as lack of interest in social activities, lack of emotions, these are negative symptoms and they are subtracted from the personality of an individual, meaning maybe they like to socialize before they have schizophrenia, and now they do not want to socialize. Along with that, there is decreased level of functioning for a significant portion of time, and it may affect work, interpersonal relationships, or even self-care. It should be present for at least 6 months. We need to rule out schizoaffective disorder, depressive and bipolar disorder, and there is a need to rule out general medical conditions and substance use disorder. Treatment of schizophrenia is a combination of biological treatment, social support, and psychotherapy. Biological treatment is acute treatment with maintenance, and it is done with atypical or typical antipsychotics. These are such as haloperidol, risperidone, olanzapine. Clozapine is only used in refractory cases. Along with that, we can add adjuvant therapy in the form of mood stabilizers, anxiolytics. Sometimes there is a need to give electroconvulsant therapy. Treat for at least 1 to 2 years after the first episode, and there is a need to treat at least 5 years after multiple episodes. Social support is given by providing social skill training, give them opportunity to enroll in employment programs. Disability benefits are also available for patients, and assertive community treatment is also present in some jurisdictions, whereas psychotherapy is done with the help of therapists, and this is either individual therapy, family therapy, or group therapy. Thanks for watching. Do not forget to like, subscribe, or comment.